Hi, my name is Cedric. So today we are back to our weekly CME. Okay, today we're going to talk about tarsal tunnel syndrome. So by the definition, it is a compressive neuropathy of the posterior tibial nerve or its branches within the tarsal tunnel, which is located along the inner aspect of the ankle. Okay. For classification wise, it is classified into idiopathic, which is they have no identifiable cause, or secondary due to identifiable causes such as trauma, varicosities, inflammation, or space occupying lesions. So for pathophysiology of it, it is none other than the compression of the posterior tibial nerve as it passes through the tarsal tunnel, leading to ischemia and nerve dysfunction. Causes may include abnormalities, inflammation, or trauma leading to swelling and increased pressure within the tunnel. Next, we discuss on risk factors. What can cause tarsal tunnel syndrome? That is a flat feet or excessive pronation, trauma to the ankle, systemic diseases like diabetes or arthritis, space occupying lesions like ganglion cysts or lipomas, varicose vein, and of course, obesity. Okay. And then next, we talk about the symptoms and clinical manifestations. So for clinical manifestation, it may present with a heel pain triad, which is firstly the posterior tibial tendon deficiency, plantar fasciitis, or the tarsal tunnel syndrome. And then patient may also complain of pain and burning sensation in the sole of the foot, tingling or numbness along the distribution of the tibial nerve, and then symptom worsens with activity and improve with rest. And for some cases, patient may also present of swelling and also sensation of tightness around the ankle. And positive tenal sign will be noted around the tarsal tunnel area. And physical examination, okay, tenal sign will be positive. Patient may have pes planus, which means flat feet. And then sensory exam will be equivocal. And then in some cases, you can see muscle wasting of the foot. This one normally all over the abductor digital quanti or the abductor helicis with pain over when doing dorsiflexion and also eversion of the ankle. Special tests, tenal test, and also nerve conduction study also can be done, and also EMG to assess function of the posterior tibial nerve and to identify the site of compression. Okay. For imaging, X-ray will be done to rule out any bone abnormalities or fractures within the area of pain. And then in some cases, they will do ultrasound to visualize the structures within the tarsal tunnel and identify the space occupying lesion. And then for detailed imaging, MRI can be done. So how do we manage and treat? So we can divide into conservative and also surgical treatment. For conservative treatment, rest and avoidance of activities that exacerbate the symptoms. You can also prescribe NSAIDs to relieve the pain and also inflammation. It is also advisable to refer to occupational therapy for orthotic devices to correct the foot alignment and also to reduce the nerve pressure. And of course, on top of this, we can educate few physical therapy to strengthen the surrounding muscles and improve the foot mechanics. And worst case, we can try corticosteroid injection to reduce the inflammation and swelling if patient present to us to clinic with this one persistent pain despite all the other conservative methods. If it doesn't resolve, then we resort to surgical treatment where we need to do tarsal tunnel release surgery. Okay. Prognosis depends on the cause and the severity of the nerve compression. So it is important for us to diagnose early, and early diagnosis and treatment can lead to significant symptom relief and also functional improvement. And delayed treatment can result in permanent nerve damage and chronic pain. Okay, that's all from me. Thank you.